So I'm Eric Hansen. I work at Brain and Body Health in Sydney, and my approach to what I do has always been to what can we do to get people out of pain as fast as possible. So I've always had a multidisciplinary style approach to my care. And one of the things that attracted me to laser therapy was when I started seeing the research where they stacked up a multidisciplinary approach to, I think it was back pain. And then they compared that to a multidisciplinary approach plus laser therapy, and clearly the multidisciplinary plus laser was much more effective. So I then started to look more specifically at all of the different types of laser out there. I really like the K laser compared to other units. It's got a lot more wavelengths than most of the other class 4 lasers out there. It's very, very easy to use. Everything's preset, but also if I read a paper where they've used some very specific settings, using the K laser, I can configure it to such a degree that if I read something, I can plug in those settings and reproduce it with this laser, which is something that you don't get with some of the other lasers. We run quite a busy clinic, and one of the concerns I had about adding laser therapy to the mix was it was going to be an extra 10 to 15 minutes worth of consult time per patient. But fortunately with K-laser, the class 4 lasers, you can get a lot done with a short amount of time. And the beauty behind the K-laser is that I can pre-program exactly what I want done for each patient. And then it's very easy to use for one of my associates or one of my assistants to come in and do the laser therapy portion for me if I am running behind on time. So for me, it hasn't interfered with timetables at all. Since adding the laser therapy or the K-laser to our clinic, we've also started to see a lot more scope in terms of patients that have been coming in. Classically, I wasn't seeing too many pre or post-surgical cases, whereas now we are seeing or helping those people out with the laser therapy. So one of the other concerns that I had with the K-laser initially is that, look, it is a reasonable expense. But since I got the K-laser, it has been more than paying itself off. So from a cost preventing me from getting one, I'm kicking myself I didn't get a K-laser earlier because it, again, been paying itself off quite easily. The other thing that's been brilliant behind the K-laser is the support. So the training that's been provided has been the one-on-one. I get responses very, very quickly. The other interesting thing about adding K-laser to the mix is traditionally, so with Brain and Body Health, we're good with back pain, but it's chiropractic and no one wants to go to see a chiropractor. But now that we've got the laser, it's laser therapy, it's exciting and it's new, so we're getting a lot more referrals for people coming in to see a laser therapy and chiropractic than we were just for chiropractic in the past. So it's certainly been an asset from a advertising and word of mouth point of view.